Miscarriage can be defined as spontaneous loss of pregnancy before the 20th week. The symptoms may include vaginal spotting and bleeding, pain or cramping in the abdomen or in the lower back, fluid or tissue passing through the vagina. Most miscarriages occurs before the 12th week of pregnancy. If the patient passes the fetal tissues through the vagina, it has to be collected in a clean container and taken to the doctor for the analysis. The causes may include intrauterine fetal death or demise, or sometimes molar pregnancies or partial molar pregnancies can also cause miscarriages, and maternal health conditions such as uncontrolled diabetes or some severe infections or hormonal problems or thyroid diseases or uterus or cervical problems may also cause miscarriages. Risk factor for miscarriages are age. Women having pregnancy or childbirth at the older age, such as 35 and above, may have higher risk for miscarriages, or the history of previous miscarriage. Sometimes uterine cervical problems such as incompetent cervix might increase the risk of miscarriage. Smoking, alcohol, and abuse of illicit drugs may also cause miscarriages. Obese patient or overweight weight of the patient may also has increased risk of miscarriage. The complications may include fever, chills, lower abdominal tenderness, pain, and foul-smelling vaginal discharges. Prevention: miscarriage can be prevented by following simple procedure or techniques such as regular prenatal care. Avoid known miscarriage risk factors such as smoking, drinking, alcohol abuse, or illicit drug use. Taking daily dose of multivitamin. Diagnosed by pelvic exam, where a doctor can check the cervix if it has begun to dilate, or ultrasound. Sometimes blood tests are done to check the level of pregnancy hormone HCG, human chorionic gonadotropin, in the blood. Miscarriages are divided into few types such as threatened miscarriage, threatened abortion, inevitable abortion, incomplete abortion, missed abortion, complete abortion, or septic miscarriage or septic abortion. Threatened abortion, where the patient may experience bleeding but the cervix hasn't begun to dilate. Inevitable abortion, the patient may bleed, cramp, and the cervix is dilated. Incomplete abortion, where the patient may pass fetal or placental material, but part of the fetal or placental material may remain in the uterus. It is considered as incomplete abortion. Missed abortion, the placenta and embryonic tissues remain in the uterus, but the embryo might have died. Complete abortion, where the placental tissues are expelled totally from the uterus. This is common for miscarriages occurring before the 12 weeks. And septic miscarriage, where the patient develops an infection in the uterus. It is called septic miscarriage. This can be very severe infection and prompt immediate medical care. For threatened miscarriage, the doctor may ask the patient to rest until the bleeding or the pain subsides or resides. And for other miscarriages, the doctor may give expectant management. So if there are no signs of infection, the miscarriage progress naturally. Medical treatment may speed the process for the body to expel the tissues. The medications can be taken by mouth or inserted into the vagina. And the surgical treatment, where a minor procedure is performed by the doctor called as dilatation and curettage.